Welcome back to the second episode of the OSCE Family Medicine for the DNB in India, which is going to be held on the 1st of September 2020. In this, we will give you an overview of how an OSCE station is made and how the whole exam is set, what kind of questions to expect. The objectives of this episode is at the end of this session, you will be able to identify how stations are made, recognize different types of stations, recognize what is expected in the exam, and confidently approach the OSCE and ace the OSCE. One background information about why OSCE to know is the Miller's pyramid to assess clinical competence. Basically, it involves the base of the pyramid is nose. You have the factual knowledge test, which is tested in MCQ, short answer, oral. This has already been done. You have proven that. But in an OSCE, we want to see, the examiners want to see if you can show how you can apply that clinical knowledge into simulated situations or questions. Types of stations: active, inactive, and rest station. Active stations in this particular exam, because there are not going to be any real patients, would be on mannequins, dummies, some case scenarios, etc. The inactive stations, which would be the majority, probably 20 out of 25 might be the inactive stations. It would be ECG, X-ray, lab reports, case scenarios, and different challenges, vaccination, growth charts, etc. And since this is a 2-hour 20-minute exam, there would be rest stations, and there would be 3 rest stations, I believe. This could change, and they would be after every 8 stations. That would be after every 40 minutes you will get a break. I'm sure all of you would be curious to know what kinds of cases in the OSCE exam. This is a grid which we have inherited. We got it through the grapevine, and basically OSCE is primary care, family medicine, public health, medicine and allied specialties, pediatrics, surgery, obs-gynae, psychiatry, and all these specialties the exams would be. And then there could be primary care, family medicine, communication skills, counseling skills, prescription writing, and you name it. It's a challenging task for the examiners to have everything in 25 cases, you can imagine. How do the examiners choose OSCE stations? Well, there are various ways. I'm just going to show you one. They decide each case or clinical condition based on the likelihood, seriousness, and treatability or prevention. To give you an example, in children or adults, vaccination, it is very common, so likelihood is high. Seriousness, no, not really a serious condition. And yes, we are talking about prevention. So routine immunizations, there might be questions on. So this could be a likely question on vaccination. Which particular one? I don't know. Again, when they have to decide for pediatrics, what's the most common condition? Children with fever. They could be serious also, and these are treatable conditions also. So that cases could be taken. So amongst pediatrics, they would choose things which you are commonly seeing. Diabetes, they won't go into, say, end-stage renal failure with diabetes. No, they would talk about different kinds of management or differently to control diabetes, when to start insulin, etc. And in adolescents, they might pick up something, common conditions like acne. And again, in acne, they might have mild, moderate, or severe. COVID-19, yes, there would definitely be questions because its likelihood, seriousness, treatability, and prevention, everything is there. So be ready. They will not ask things like Brugada syndrome. Now, this might appear to be a complex table, but this is again how they make stations. Some stations might be very easy and some would be very difficult. So they want to find out what the level is to give the chance the brighter students to do well and the average students to pass. So they divide them into a grid of, or the questions can be divided into a grid of simple patient, simple problem, complex patient, simple problem, simple patient, complex problem, and complex patient, complex problem. Sounds like a tongue twister. I'll show you examples for the same. Take the case of a simple patient and a simple problem. 50-year-old man, healthy, not on any medications, comes for a routine health checkup, family history of ischemic heart disease and diabetes. He doesn't have any history. And an examination, BMI is 27 and the blood pressure is 150/98, and examination findings are given as normal. How will you manage this case? Basically, he has two issues. One is blood pressure, second is BMI. You give the routine what you do. So this is a simple case, simple problem. Next, higher level, we come to simple patient and a complex problem. In this, a 64-year-old female, known case of hypertension, hyperlipidemia, on multiple medications, irbesartan, nifedipine, hydrochlorothiazide, and rosuvastatin. But today she presents with episodes of palpitations, with occasional chest pain on exertion, and on examination, her pulse is irregularly irregular, probably atrial fibrillation, and the blood pressure is again high, and the BMI is 27. So it gets a little bit more complex than the previous one. Proceed with the management of this case. How will you address this? So it is very important to read the question, which we'll say again and again in this presentation. Next is a complex patient with a simple problem. So to give you an example, 88-year-old male with dementia, lives in an apartment, whose wife is also 85 years old. So both are just the two of them. He has fever with chills, and on examination and investigation, which is basically urine culture and sensitivity was done, was found to have a UTI. You proceed with the management of this acute problem. So this is a complex patient. It has got multiple issues, living alone, dementia, etc. But it has got a simple problem. How will you manage it? This is a challenge again. Oh, the going gets difficult. It's a complex patient and a complex problem. Example, 64-year-old female, known case of hypertension, hyperlipidemia, osteoarthritis knees, obesity, on multiple medications, irbesartan, nifedipine, hydrochlorothiazide, rosuvastatin, and Voltaren gel, paracetamol as and when required. Presents with episodes of palpitation with occasional chest pain on exertion. Pulse is 110, irregularly irregular, blood pressure is high, BMI is 32, and because here the complexity is she can't walk around too much, and she's got multiple problems, can't lose weight, she has probably atrial fibrillation, so multiple problems, and becomes a more complicated case. So in this case, how will you proceed with the management? So for the simple and complex problems, what should your strategy be? Number 1, read the question. Number 2, read the question again. Number 3, read the question again and again and again. I can't emphasize this more, but that's where success and failure lies. There should be clues, pointers, what specific answers are required. Continuing with the strategy, again, it's important, do not download all that you know. If you write too much, they won't give you extra marks for that. They know that you have passed the theory and you have proven your knowledge base. The OSCE is testing how you apply the knowledge. So read the question, see what they are asking, and answer. Again, a good habit while preparing for the exam is the day before the exam, and before that, if you want to have your output good, be in a calm and composed manner. Eat light the day before the exam. Oats, oatmeal, toast, nuts and fruits, apple, bananas. Drink a lot of water. Maybe take water along with you in the examination hall. But you need to be well composed. This was in brief about how stations are made. Now, to be continued in future episodes would be practice stations. Episode 3, 4, 5, and we can do as many as possible given the time. But important to note that we cannot cover all the stations, all the domains, all the subject matter. That you will have to face it. And there again, I say, if you are calm and composed, everything will fall into place. All the best, and end of session. Thank you.